Alzheimer's ought to be a concern for every American. For ourselves, for our families, the cost economically, but cost personally and to families is exorbitant. And we are on a path towards that getting worse year by year unless we find a way to delay, prevent, or cure this disease. This is a huge priority for NIH, working with the private sector in very creative ways. But a lot of this is really trying to do the basic science of understanding what goes wrong in the brain in that disease. And I am actually pretty excited about some of the discoveries, some of them as recently as a month ago, that tell us we may be on a pathway towards finally coming up with a way to intervene that's going to work. But that takes huge amounts of effort and investment. You have to do clinical trials with thousands of people. You need to be sure that all the various elements of this condition have been considered. And right now, you know, we're not going as fast as we could. We say this is a public health emergency. We say we've got $1 trillion budget problem in a few years, and we are not doing everything we could because we are not considering medical research as an investment. We're just thinking of it as an expenditure. And we basically look at the federal deficit as the thing that we worry about saddling our grandchildren with. Do we want to saddle them with Alzheimer's disease? Do we want to saddle them with cancer? If we're really worried about future generations, this is the place we should be making those investments.
Ebola.
Yeah.
Is it under control?
Ebola is in a much better place than it was, certainly, a year ago when this outbreak in West Africa came forward and it took the lives of thousands and thousands of people. We at NIH, as our job, fast-tracked with much help from FDA and with partnership with Liberia, Sierra Leone, and Guinea, the development and application of a vaccine. And there are thousands of people now in West Africa who have received those vaccines as part of a clinical trial, and it's looking very good. We also have fast-tracked as much as we can the development of a therapeutic, this thing called ZMapp, which is also now in a clinical trial to see whether it really works or not.
Should the U.S., should people in the U.S. be concerned about any other outbreak?
Yes.
Is there something that you're seeing that we're not seeing right now that has the potential to impact the U.S.?
And it's influenza. If people are going to worry about a worldwide epidemic that could really be scary, that would be the next big influenza epidemic. 50 million people died in 1918 from influenza. We know that there are opportunities for that virus to mutate. It lives in other species, birds and pigs, and occasionally it jumps across into humans. We've watched with some alarm the H5N1s and the H7N9s. Those are different types of influenza that are not very far away from becoming transmissible in humans, but they haven't gotten there yet. But there's something we could do about that. Through the work of immunology and genomics, we are really learning that there is a path forward to making a vaccine that would actually work against all influenza viruses. That would mean, by the way, you wouldn't have to take your shot every year and find out, like this year, that it didn't actually work very well. But more importantly, it would mean you would have a vaccine that would protect against that next worldwide epidemic for which we are overdue. Again, are we going as fast on that as we could? No.